In this short video, we're going to cover how you treat something called Jock Itch, which is an infection of the groin area caused by a fungus. The medical term for Jock Itch is Tinea Cruris or ringworm of the groin, and I'll briefly outline causes, symptoms, tests, and treatment. Now, Jock Itch occurs when a type of fungus grows and spreads in the groin area, and it occurs mainly in adult men and teenage boys. It's also more common in overweight people with deep, moist skin folds. Now, losing weight might help prevent the condition from coming back, and some people who've got this infection also have athlete's foot or another kind of ringworm, and that's because tinea, which is the fungus that causes Jock Itch, thrives in warm, moist areas. Now, Jock Itch can be triggered by friction from clothes and prolonged moistness in the groin area, such as from sweating. So if you exercise a lot, then you're more prone to getting it. Jock Itch can be passed from one person to another by direct skin-to-skin contact or with contact with unwashed clothing. So it's really important that you don't share towels or clothing if you do have Jock Itch. So let's move on now and discuss some of the symptoms. And in terms of symptoms, it usually stays around the creases of the upper thigh and it doesn't involve the scrotum or penis. Jock Itch may spread near your bottom, causing you to potentially feel itching and discomfort in that area. In terms of other symptoms, you might notice a red raised scaly patch that might blister and ooze, and the patches often have sharply defined edges with scale at the edges. You may also notice abnormally dark or light skin, and sometimes these skin changes can be permanent. In terms of examinations or tests, well, your healthcare provider can usually diagnose Jock Itch based on how your skin looks. Tests are usually not necessary, but if they are needed, then they may include taking some skin samples to try and isolate the fungus. Moving on now to the most important point, and that's treatment. Jock Itch usually responds to self-care within a couple of weeks. The key things that you need to do are keep the skin clean and dry in the groin area. Don't wear clothing that rubs and irritates the area, so try to wear loose-fitting underwear like boxer shorts. Try to wash boxers or underwear that you use frequently, and try to use over-the-counter antifungal or drying powders that can help control the infection, and you can talk to your pharmacist about which one might be best for you. These usually contain medicine such as metconazole, clotrimazole, or terbinafine, and these are all antifungal agents. Now, if you're treating this at home with medicine purchased over the counter and it's not working after 2 weeks or at least getting better, then you might need to speak to your doctor, especially if it's severe or it frequently returns. Now, your health provider may prescribe stronger topical antifungal medicines. These are medicines that are applied to the skin, or even oral antifungal medicines. Antibiotics might be needed to treat bacterial infections that occur from scratching the area. If you tend to get Jock Itch, continue to apply antifungal or drying powders after bathing, even when you don't have Jock Itch. And thankfully, Jock Itch usually responds promptly to treatment. It's often less severe than other tinea infections such as athlete's foot, but it may last a long time. Finally, you should contact your health provider if the Jock Itch doesn't respond to home care after 2 weeks, or if you've got other symptoms.